All right, everyone, buckle up because today's deep dive is a big one. We're talking healthcare, specifically those MediShield Life changes everyone's been buzzing about.
Yeah, this isn't just some minor tweak. We're talking a major overhaul of the system we all rely on.
That's right, MediShield Life. That basic health insurance that's supposed to be there for us when things go wrong. And let's be honest, healthcare costs these days, they can be scary.
No kidding. That's the whole point of MediShield Life, though, right? To make sure we don't go bankrupt if we get hit with a hefty medical bill, it's about having that safety net.
Exactly. So, big picture, what's changing? From what I'm seeing, MediShield Life is getting its biggest makeover since, 2015? More coverage, which sounds great, but also higher premiums. Is that the trade-off here?
It's a balancing act for sure. The government's trying to make sure MediShield Life stays afloat, especially with an aging population and healthcare costs going through the roof. But will pumping $4.1 billion into it be enough? And will everyone actually benefit? Those are the big questions.
$4.1 billion, that's not chump change. But before we get into who gets what, let's break down the actual coverage changes. What jumped out at me were those increased claim limits. What does that mean in real life? Say if someone needs to stay in a hospital.
Okay, so let's say you're in the hospital, thankfully a normal ward, for a few days. Right now, MediShield Life covers up to $1,000 per day for those first 2 days. They're talking about increasing that to $600 and $630.
Okay, so a decent increase, but what about the scarier stuff? Like if you end up in ICU, those bills can be astronomical.
Absolutely, and that's where this gets really important. For ICU stays, that daily claim limit is more than doubling. Right now, it's $2,200, but they're proposing to raise it to $5,140.
That's huge. I've seen those heartbreaking stories where people get stuck with massive bills because they hit the MediShield Life limit. Sounds like they're addressing that too, right?
Yeah, that policy year claim limit, which is the maximum MediShield Life pays out each year, is increasing too. It's going from $150,000 to $200,000. That could be a lifesaver for people facing major medical expenses.
That's reassuring, at least. But healthcare isn't just about hospital beds these days, is it? There's a big push for doing things outside the hospital now, managing things in the community, even at home. Does MediShield Life reflect that?
That's a really good point. Traditionally, MediShield Life has been very hospital-focused, but that is starting to change, and some of these changes could be a game changer, especially for people with chronic conditions.
Give us an example. What kind of changes are we talking about for people who need regular treatment, but not necessarily in a hospital? Give us an example. What kind of changes are we talking about for people who need regular treatment, but not necessarily in a hospital?
Well, take dialysis, for instance.
Oh.
It's literally life-saving for people with kidney failure, but so expensive. Right now, MediShield Life will cover up to $1,100 per month for dialysis. With these new changes, they're raising that to $750 per month.
That's a huge help, especially because people on dialysis, it's not just a one-time thing. That's every month, multiple times a week, right?
Exactly. And it's not just about increasing those existing limits. They're actually expanding coverage to include new outpatient treatments, too. One that stands out is something called RTMS, repetitive transcranial magnetic stimulation. It's used to treat depression and will now be covered.
That's a big deal. Mental health is so important, and this could really make treatment more accessible.
Absolutely. And they're also adding coverage for some types of home-based care, which makes sense. It's about recognizing that the most appropriate setting for care isn't always a hospital bed.
Makes sense. Okay, so we've talked about increased claim limits for being in the hospital, expanded coverage for those outpatient treatments, more focus on home-based care. But what about those really cutting-edge and, let's be real, super expensive treatments? I'm talking about things like cell, tissue, and gene therapy products. It's a mouthful. What are those exactly?
Yeah, those are a mouthful. Cell tissue and gene therapy products, or CTGTPs for short, are basically revolutionizing how we treat some really tough diseases.
Yep.
Certain types of cancers, genetic disorders, that sort of thing.
They sound incredibly promising, but I know the cost can be a barrier. Are these treatments becoming more accessible under these changes?
Now, this is where it gets interesting. Right now, MediShield Life doesn't cover CTGTPs at all. But come October 2025, that's changing.
Does that mean full coverage, then, for anyone who needs a CTG-TTP?
Not quite. It's a bit more, well, nuanced. They're still working out the details, but the plan is to extend both MediShield Life and MediSave to cover these treatments, but with limits. The goal is to cover enough of the cost so that around 2 out of 3 subsidized patients will have their treatment fully covered.
So 2 out of 3, that's a good start, but that still leaves a significant number of people facing potentially high costs.
You're right. This is really just a first step in bringing these amazing new therapies into our healthcare system. It's about finding that balance,
Hmm.
innovation and accessibility, but also keeping things financially sustainable.
Absolutely. And that brings us to I guess, the elephant in the room with these MediShield Life changes. The cost. More coverage is fantastic, but those benefits don't come cheap. We're talking about higher premiums. And that's going to hit some people hard.
Yeah, no doubt about it. The government knows affordability is a big concern, especially now with the cost of everything going up. That's why they've announced a hefty support package, $4.1 billion to be exact. The aim is to help offset these premium increases, particularly for those who are more vulnerable.
Okay, $4.1 billion, that's not an insignificant amount of money, but who exactly benefits the most, and will it be enough to soften the blow for everyone?
That's what we're going to look at now. Let's break it down and see where that money's going and what it actually means for you.
Okay, so we're talking about a $4.1 billion support package to help with these MediShield Life changes. Where's all that money going?
Well, you can think of it like two main buckets. First, we have premium subsidies. They're getting a boost, about $700 million over the next 3 years.
So, more help for those who already get subsidies. What's that going to look like for people?
Let's say you have someone on a lower or middle income, maybe an older person, who relies on MediShield Life.
Mhm.
The highest subsidy they can get right now is 50% of their premiums. Starting in April 2025, that maximum is going up to 60%.
That's significant, especially with those premiums going up.
Exactly. And then the other bucket, the bigger one, is that $3.4 billion for MediSave top-ups. This is where they're really targeting specific groups who might struggle with those higher premiums.
Okay, so who are we talking about here?
Let's start with the pioneer generation, those born in 1949 or earlier. They already get an annual MediSave top-up to help cover their MediShield Life premiums, right? Well, that's increasing. Could be by as much as $300 a year.
That makes a difference, especially for seniors who are often on fixed incomes.
Absolutely. And then we have the Merdeka generation, those born from 1950 to 1959. They, along with those considered young seniors, those just entering their 60s, are in line for a one-off MediSave bonus as part of the Majula package.
Right, the Majula package was announced earlier to help with the rising cost of living in general. How much are we talking about specifically for healthcare, though?
Initially, the MediSave bonus under the Majula package was up to $1,500. With these changes, they're adding another $500 on top of that. So potentially $2,000 to offset those premium hikes or even just other medical expenses.
Okay, that's the pioneer generation, the Merdeka generation, young seniors. What about everyone else? Any help for them?
There are a couple of things. For one, starting April 2025, the MediSave grant that parents get for newborns is going up from $4,000 to $5,000. And for those born between 1974 and 2003, they're getting an extra $200 added to that one-time MediSave bonus that was part of this year's budget.
It sounds pretty comprehensive, but let's be real. With changes this big, someone's going to end up worse off. Who's going to feel the pinch despite this support?
It's the big question, isn't it? The government says over 90% of Singaporeans will actually be better off over the next 3 years. But you're right, there will be some who see their out-of-pocket healthcare costs go up. Probably those with higher incomes who don't qualify for as much support.
It's always a balancing act, trying to make the system sustainable, but also making sure no one falls through the cracks.
Exactly. Speaking of new approaches, did you see anything about that new pilot program? The one linking MediShield Life premiums to healthy living?
Yeah, that caught my eye. So they're going to start tracking how many steps we take, what we eat. Sounds a bit Big Brother, no.
It's not quite that intense. It's more about giving people incentives to be healthy. Basically, you can earn discounts on your MediShield Life premiums by racking up health points through that Healthy 365 app.
Oh, right. The app from the Health Promotion Board. I've used it before. You get points for exercising, tracking your meals. It's a good motivator. So now those points could actually save you money on health insurance.
Exactly. It's a really interesting concept, don't you think? Tying your health insurance costs to your actual health outcomes.
It really makes you wonder, what's next for health insurance? Will we see more programs like this, where our premiums are directly linked to the choices we make?
It's something to think about. And it really highlights something important. These MediShield Life changes, they're about more than just numbers and policies, right? It's a shift in how we approach healthcare. It's not just about treating illness anymore. It's about staying healthy, taking responsibility for our health.
That's a great point. Well, we've covered a lot of ground today. Higher claim limits, expanded coverage, those premium increases, the support measures, and even that interesting link between healthy living and your wallet. It's a lot to unpack.
It really is. But the key takeaway here is this. The MediShield Life 2024 review, it's going to have a ripple effect on Singapore's healthcare landscape.
Hmm.
Understanding these changes, that's power. It lets you make informed decisions about your health, your finances.
Couldn't agree more. And on that note, we'll leave you with this. As we see more emphasis on things like outpatient care, treatments at home, how might this change the demand for healthcare professionals? Could it even change how healthcare services are structured and delivered here in Singapore? Something to think about as we navigate this new healthcare landscape.